We just sometimes forget to use
So we
them.
need to.
I call this meeting of the Craven County Board of Education to order, asking Dr. Miller if she would please do the roll call for us at this time.
Good morning, board members. If I can take this privilege to mention something to you. I hope you enjoyed walking in this morning and seeing the sidewalk. And I just want to give kudos to a student who at this point would like to remain anonymous, but did contact me because last Friday we made it Kindness Day in our district. And this was a student's kindness project to bring us all together and to celebrate that we all work together for a common purpose. So I did want to celebrate that student this morning, and I hope you got some pleasure because there was a section that mentioned the board members, and everyone at central office was truly blessed yesterday approaching that to start our week. So, and now I will start with the roll call. Ms. Frances Boomer.
Here.
Ms. Naomi Clark.
Present.
Mr. Victor Dove.
Present.
Mr. Carl Ipock.
Present.
Ms. Stephanie King. Here. Ms. Kelly Muse.
Here.
Ms. Kimberly Smith.
Here.
Madam Chair, you have everyone here. You have a quorum.
Thank you. And at this time, I'd like to know if there are any amendments to the agenda for today. All right, since there are none, I need to get a motion to adopt the November 16th, 2021 board work session agenda.
So moved.
Second.
It has been moved and second that the board work agenda for November 16th, 2021 be approved. Are you ready for the question? All those in favor, let it be known by saying aye.
Aye.
Those opposed, the same. Ayes have it. Motion is carried. And at this time, I would like to share our mission statement with everyone and our vision statement. And it reads, the vision statement reads, we envision a public education system that challenges all students as learners and prepares them to imagine and create a successful life, values educators and empowers them to inspire and spark innovation in every student, leads in education and community engagement, and invites all students, their families, and all members of the community to work together to support public education to the benefit of our students, our community, our nation, and our world. Our mission statement is, together with our families and community, Craven County Schools will educate all learners to personal, professional, and civic success through challenging and personalized instruction. And at this time, I'm going to ask Vice Chair Kimberly Smith to review the ground rules, the bin items process, and the safety procedure in the event of an emergency with the attendees of the Board of Education meeting at this time.
Thank you, Chairman Boomer. Our meeting ground rules are posted on the back of the green, the big, large green sign. We use them at all of our Craven County school meetings, schools and system level. They include posting and approve the agenda, listen as an ally, one person speaks at a time, respect each other, no sidebars, everyone participates, stay on task, start and stop on time, schedule appropriate breaks, evaluate at the end of each meeting. And if everyone could make sure your electronic devices, cell phones, anything that beeps, watches, anything that beeps that could interrupt the meeting, if you could silence those at this time. Just kind of better yet, just turn them off so you can be present in the meeting here. And just to remind board members that we want to encourage them not to be texting and stuff during the meeting because it brings people into the meeting in a way that the people that are in the room with us can't engage. So If we could just put them away, that would be great. The ban item, if you have an off-task thought, you could put it on the sticky note, put it on the front. Chairman Boomer will get those before the meeting is over, make sure everything is addressed. If we were to have a tornado today, we'd split the room in half right by Mr. Silvera. You can't see him in the World Wide Web, but here in the room, we see him. To the right, we're gonna divide the room that way, go into the interior hallway. We divide the room to the left, the Mr. Salvera, and go into the interior hallway. We get down, cover our heads until we have the all clear. If we were to have an intruder in the building that was not in the room, we would we would lock the doors, secure the building, alert, call for help, and wait for the all clear. If we were to have an intruder that was in this room, we would alert the building, call for help, and then we would counter as best of our ability and just take care of each other.
Thank you. And at this time, I'll ask our board attorney, Mr. Ryan Gaucho, if he would do our invocation for us this morning.
Board members, if you'll please pray with me. Eternal God, we pray for your shalom, your peace for our world, for our nation, our communities, and for our families. In you, we find all that we need to be whole and well. In you, we are grounded in truth, that we would show integrity and honesty. In you, we are given purpose, a vision of what it means to dwell in harmony. In your peace, we have all that we need to live and thrive. So if we align ourselves to your paradigm of peace, grant us your favor. If we humble ourselves, grant us success in our endeavors to do your will. If we trust in you, give us a wealth of confidence in our abilities to carry out your intent. If we follow your guidance, prosper us with your bounteous grace, that we would experience the certainty of your blessing. Then may our world, our nation, our communities, and our families receive that blessing this day. In the peace of your name we pray. Amen.
Amen.
And at this time, I would like for everyone to please stand, and we're going to ask board member Naomi Clark if she will lead us with the pledge of allegiance.
Thank you, Madam Chair. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Amen.
Okay. My seat does not want to cooperate. And at this time, we would like to take the opportunity and the privilege to introduce our wonderful visitor for us today. We have our parent representative, Ms. Desiree Connolly, and she is a parent of a student at J.T. Barber Elementary. And we also have Colin, Cadet Gerard, and after, I just asked him about his name, Itoriana Matthews, he's from Havelock High School. Both of these students are from Havelock High School. We are very honored to have them with us today to be a part of our board meeting. Ms. Clark, you're not the only one who's happy to have them. And West Craven has a stake in this also. And West Craven has a stake in this also. It's because his at your honor mama is a graduate of West Craven. Oh, I just thought I'd let you know that. They get all excited. But we are very happy to have all the three of you with us today. And I know that you can give us an input that would help us as we discuss certain issues, okay? Okay, at this time, I'm gonna call on Vice Chairman Kimberly Smith to facilitate a discussion of the board's work goal.
And I'm actually going to turn it over to Ms.
Oh, wait a
Clark.
minute, I'm sorry, I'm going too fast.
Yeah.
I need to recognize also any elected official that's listening or who's present with us today. We definitely want to recognize our two representatives, our teacher of the year, Ms. Marshall, and also our principal of the year. We're glad that, we know you hate leaving your school today. But they'll be all right until you get back. I'm sure they get good hand, but thank you for coming to help us out today. And now, Ms. Smith.
And I, just so, for those that don't know and wonder why I'm shifting to Naomi, because this is my last year on the board. So we are moving into Naomi's becoming the goal manager because she will be here. So part of good leadership is to make sure that everything continues on, so that you're going to see that transition. You might see her asking me sometimes something. That's just because we're transitioning to her. She's the goal manager now. So I'm going to turn it over to her.
Thank you, Madam Vice Chair. Board members, you've been provided with a packet. First page says board policies. I would just ask that you have that readily available because we're going to be interacting with that. Mr. Severa, do you have a summary of board retreat that you can pull up for me, please? But anyway, we'll just go off of there. Board members, as you recall, we had a board retreat in September. Very important, so there'll be no corny jokes spewing forth from me today because it is serious. We did the board survey and there's 3 areas, quite frankly, that we fell down upon. They were, 1, the board works with the superintendent and staff in a climate of professional and mutual respect. We received 16%, and it is back. Second goal is the board works as a team and leading the district. We received 8%, which is abysmal, but we're working on it. Lastly, the third lowest goal was the board makes decisions to support the district priorities and not individual board member agendas. 16%. So these were our 3 lowest targets that we're going to work on and have been working on in the future. At this particular retreat, we also received, I thought, a very beneficial training to help us move forward. It's one thing to talk about respect, but what does that mean? It's another thing to talk about mutual respect. But again, we had some, I thought, intuitive and self-reflecting exercises. And Dr. Miller oftentimes uses the quote, "It's not enough just to walk the walk, we're gonna walk the talk." And many of the cabinet members and the board members know that I oftentimes like to spew forth fidelity. Well, fidelity applies to the board as well, Dr. Miller. So we're all striving. And that being said, we talked about ethics. And ethics is our moral compass. And again, we are mindful that we as board members, we must model good behavior. Not perfect behavior. It's okay to disagree, but we again have to be pivotal in respecting one another and accepting differences, because we have not just parents and other stakeholders, but we've got kids. And I say that endearingly. So that being said, Chairperson Boomer, you're next on the agenda insofar as taking us through our code of ethics.
Okay.
And then you
Board member ethical requirements. We did go over these. The following standards will guide each board member in the performance of his or her official duties. The need to obey all applicable state and federal laws regarding official actions taken as a board member. The need to uphold the integrity and independence of the board member's office. The need to avoid impropriety in the exercise of the board and board members' official duties. The need to perform faithfully the duties of the office, and the need to conduct the affairs of the board in an open and public manner, complying with all applicable laws governing open meetings and public records. Under B, specific board member commitments, very important. In order to implement the above standards, each member of the board commits to do the following: attend all regularly scheduled board meetings insofar as possible, and become informed concerning the issue to be considered at those meetings. Endeavors to make policy decisions while always keeping in mind the objective of providing students the opportunity to receive a sound basic education, and only after all full discussion at public held, only, you need to hear this, only a sound basic education, and only after full discussion at public held board meetings. Render all decisions based on the available facts and independent judgment, and refuse to surrender that judgment to individuals or special interest groups. 4, encourage the free expression of opinion by all board members and seek systematic communications between the board and students, staff, and all elements of the community. 5, show proper and due respect to fellow board members. 6, respect the confidentiality of information that is privileged under applicable law. Work with other board members to establish effective board policies and to delegate authority for the admission of the schools to the superintendent. Number 8, communicate to other board members and the superintendent expressions of public reaction to board policies and school programs. 9, learn about current education issues by individual study and through participation in programs provided needed information, such as those sponsored by the state and national school board associations. 10, comply with North Carolina General Statute 115C-50 by earning the required 12 hours of training every 2 years. 11, comply with General Statute 1608-87 by earning 2 hours of ethics education within 12 months of election or appointment to the board. 12, support the employment of those persons best qualified to serve as school employees and insist upon a regular and impartial evaluation of all employees. 13, avoid being placed in a position of conflict of interest and refrain from using the board member's position on the board for personal or partisan gain. 14, take no private action that will compromise the board or administration. 15, recognize that authority rests with the whole board assembled in a properly called meeting. 16, remember always that a board member's first and greatest concern must be the educational welfare of the students attending the public schools. 17, seek to provide equal educational opportunity for all children, regardless of ability, race, creed, or culture. It shall be the understanding of each member of the board that 1, this code of ethics is intended to establish a sound, effective basis of operation in accordance with a high and reputable standard of conduct and commitment to the public good. And two, any violation of this code of ethics by a member of the board in the course of discharging the duties of the office damages the reputation and effectiveness of the board in its conduct of the public's business. All newly elected board members are expected to sign a code of ethics statement that include these provisions at the organizational meeting of the board. Ms. Walker.
Madam Chair, I would just ask that we go ahead and sign this today, just moving forward.
And this is you're talking about the code of ethics pledge, right?
Yes, ma'am.
Okay, so you want me to get everybody to sign it after the meeting?
They can sign it now, ma'am.
Okay, that's fine. So if you have it and you know that these are true standards and we do try to live by them, and so we should not have any problem with signing our signature, and you may pass them down to me.
Thank you.
And you may give today's date.
Yes, ma'am.
Thank you. Okay.
Thank you.
All right, thank you for your signatures. And at this time, Ms. Walsh.
Thank you. We'll be just coming back and forth. Again, at the retreat, we talked about certain things that needed to be done, but so what? We need to talk about what the next steps are. And I would ask board members that you pull out a sheet entitled Board Relations, Board Relationships, rather. And we're gonna do like we do our students, round robin. So, Ms. King, if you would read A1,
A1,
please.
I will, if I can see it.
A-
Board members, board relations, subsection A, number 1 reads, board members may use mail, email, text messaging, fax, phone, voicemail, committee meetings, or personal contact to communicate with each other. However, board members shall never meet, talk, text, or email in a group large enough to constitute an official meeting, typically 4 or more, unless notice has been posted. Text messaging and emails to the full board are discouraged to avoid any appearance of misconduct. If they are used to schedule updates or standard operations, please reply directly to the originator of the text and not the entire group. The chair shall have notice of all scheduled committee meetings for awareness only.
Thank you, Ms. King. Ms. Hyde, would you take A subsection 2 and B1?
Yes, ma'am. Board members who use any social media platform should be careful to avoid online conversations that could be construed as speaking for the board or that might appear to constitute a meeting. And then B, under superintendent, 1, board members will use the agreed upon stakeholder concern process to keep the superintendent informed of concerns in a timely manner. It is the superintendent's job to take action and resolve situations. Board members should not violate the chain of command. Doing so could unintentionally undermine and cause unclear expectations between staff, superintendent, and the board.
Thank you, sir. Mrs. Muse, would you read 2 and 3, please?
Superintendent will communicate information to all board members in a timely manner, including requests from individual board members, which she does a great job.
Thank you.
Questions submitted to the superintendent via email or other electronic means should not be sent simultaneously to the entire board. Doing so may constitute an online meeting. The superintendent will provide the answers to the questions from any board member in a response to the full board. This allows everyone to get access to the same information without opening a forum for discussion.
Thank you. Mr. Smith, would you please read 4, subsection 4?
Yes. Information shared by the superintendent to the board in closed session will be kept confidential until the superintendent notifies the board that the information is now public.
Mrs. Boomer, would you please read C1?
Board members are encouraged to visit with staff members and learn more about their responsibility with the district, but are never to give staff members direction or orders. If a board member has questions concerning the performance of district staff, they should direct those questions or concerns to the superintendent.
Thank you. And Mr. Dove, would you wrap it up, please, and take 2 and 3?
Board members are encouraged to visit campuses while at the same time ensuring the visits don't impede the delivery of instruction in the classroom. It is advised that board members notify the schools in advance of the visit, if at all possible. Board members are encouraged to remember the chain of command for complaints, concerns, and requests from staff members during any visit. When making any, number 3, when making any official campus visit, board members should wear their name badges and follow all campus check-in procedures.
Thank you, Mr. Dove. Mrs. Beers and Mr. Dove, this was approved before you two came on board, but it was reviewed and approved by the board prior to your sitting on the board. Let's move on. If you would pull strategies for modeling professional behavior, board members. Just like I, as a board member, asked the superintendent to mete out consequences if there's an infraction, that too applies to board members. This too was approved and reviewed by the board last year. And I will read it because it is very important. Consequences. Strategies for modeling professional behavior. What happens if a board member violates any section of policy code 2120, Code of Ethics for School Board Members? It is the responsibility of the chair to make sure all members are aware of and familiar with the Code of Ethics policy. Once a year, the chair should conduct an annual review of the Code of Ethics policy and have each board member sign an agreement to follow it. If a board member violates any portion of the policy, the chair can draw from the actions below as a recourse. 1, a private verbal reminder of the specific concern and request to discontinue the inappropriate behavior and why the inappropriate behavior is not representative of the board code of ethics agreement. The chairperson will keep documented records of this verbal conversation. The chair may offer an opportunity for professional development, board training if available. If the behavior disrupts a meeting of the board, the chair will call the meeting to order and ask the behavior to stop. After 3 warnings, the chair will call for a recess. If the inappropriate behavior continues, the chair shall provide a written warning to the board member with specific violations noted, including a statement of agreement by a majority of the board members that the behavior is inappropriate. If after both verbal and written warnings, the violations continue and are unresolved, the board chair has the authority to seek a private censure of the offended member by the full board. This will be done in closed session and will provide a written notice of the specific violation and any satisfactory remedy that might be available. If after all of these steps have been exhausted, the full board could choose to enter into the public record a written sanction of the offended member. This would be in the form of a resolution which would list specific violations, warnings given, remedies made available, and any other efforts to resolve the matter before taking a public action. The resolution will be read aloud in a public meeting, voted on by full board, and entered into the public record. If after all of these steps have been exhausted, the chair can request the resolution from the full board be referred as a violation of statute to legal counsel and request resignation of the violating board member by resolution of the full board. And thank you. As we move on, I'm sorry, any questions about that? As we move on, and I confirmed with the current Go Team Manager collaboration, there's some suggested goals of how we're going to improve ourselves with fidelity. Suggested 1.5A, the board will increase all 3 targeted areas of performance on the board satisfaction survey by 50% within 1 year, and we can get this done. We will accomplish this by surveying on only the 3 targeted areas quarterly in order to progress, monitor, and make adjustments as needed. We will enlist the help of all board attendees who will have the opportunity to PDSA our meetings, as well as using an agreed upon process. This PDSA data will be collected and included for the board to review and to help make adjustments as needed. And Mr. Dove, you're the suggested owner, and we can talk about it later. We'll work with staff to ensure this process is in place, and we'll report monthly during goal work as to suggestions for improvement for the board. Go owner, Mr. Dove, you'll work with me to report the quarterly data and any opportunities for improvement. And that's not locked into stone, it's just a suggestion, but we can talk later, Mr. Dove. Suggested goal 1.6A. The board will work with the superintendent to develop a year-long targeted training and team building calendar of professional development based on our needs. This will complement the goal currently owned by board member Mrs. Muse. We will accomplish this by working with staff to assign training specifically aligned to the 3 targeted areas that will help us improve our performance. Mrs. Muse, suggested owner, will work with Mrs. Michelle Lee to define specific opportunities, coordinate a consistent date for trainings, and to PDSA the process following each training to allow for any needed adjustments. Suggested goal 1.4A. And this goal will work in tandem with goal 1.4, currently owned by Ms. King. This board will regularly and with intent improve the community at large in celebrating and supporting those Craven County school educators who have gone above and beyond and helping students succeed. This goal will change based on what is happening in the community, i.e. state and nation, hurricanes, pandemics, floods, etc. The first intentional targets will include allowing community, parents, and students to nominate teachers who have gone above and to help students succeed throughout the course of the pandemic. Mrs. Clark, myself, Mrs. Smith, and Ms. King will work together in trying to get this implemented. All board members will take responsibility for visiting the nominees within reason from their district and delivering a certificate of recognition, 30 days of recognition with a goal to announce winners the last day before Christmas break. Next steps, priority goal work. There will be Ms. King owner. The board will proactively promote, support, and recognize classrooms and schools that are implementing a systems approach to improvement. Again, not locked in stone. These are suggestions. Won't be successful unless all of us as board members work together, but I'm heartened about what we can do in the future. Are there any questions or concerns? If you don't have any today, you can certainly text me or put stickies. Mrs. Smith, did you have anything to add?
I just want to, the goals were not just pulled out of the air. They were pulled specifically from those areas where we were struggling. So I hope you guys can see that, the alignment of the pieces. The goals are set to help us improve. And what we'll do is, as Mr. Dove reports quarterly, we'll check on these other goals as well too. Is our training aligned? Is it working? Is it helping? If it's not, we'll adjust. We'll adjust as we go along. And the quarterly survey is just those 3 questions. It's not the full survey. It's just those 3. And we want to be able to see progress. And the staff will handle these participants.
Yes.
I can't speak. Those of you that are watching us today, you will get to say, when we PDSA our meetings, you guys will get to do that now. however format Dr. Miller, she might have already thought of it if you want to share that. And then
One of the things we certainly want is the public input, and we have folks that attend the meeting, and one of the suggestions is to have a board here at the end and have some sticky notes available and take some feedback from those attending the meeting, and also those that are tuning in. We will come up with a way for them to give us feedback as well, so that the board is modeling continuous improvement, just like our teachers. So I appreciate your willingness to step out and take feedback so we can all get better together.
which is the point of all the work, right?
Thank you.
And then just remember, guys, this whole thing needs to go in your manual.
Thank you.
Ms. Clark, I didn't get a copy of that. What you just read?
Now, what you just read, you don't have it.
Yeah, we don't have that.
You don't have it, but I can provide
You
you,
get one?
yes, ma'am.
Thank you.
I'll provide you with it as the chair. That being said, Madam Chair, I have nothing further.
Okay, Ms. Clark, Ms. Smith, you have any more to add to that?
That is it. Just pointing out the priority goal that she said at the end, that goal's already in place. That was just saying that's the goal that aside from these three targeted ones, we need to focus on moving forward. So Ms. Lee and Ms. King can work on that.
Thank you, Ms. Clark, for that presentation, but that we did need to go over all of that.
Yes, ma'am, I think
That
so.
puts us right back and put us on the right track.
Thank you, I
We
agree.
Appreciate that. And at this time, we're going to ask Dr. Miller if she would give us she would do whatever she's gonna do.
I have 3 updates for you today, and I appreciate the board allowing me to move up on the agenda. I'm normally at the end, but we have some folks here today, and we want them to get back to doing the work they do. Joining us today, Scott Harrelson, the Craven County Health Director, and I was joking with him earlier. I actually gave him a slide so he can come up here and you can have conversation with him, and also Luann Mack, now our lead nurse for Craven County Schools. So as I present today, certainly stop me during the presentation, ask any questions. And then, as I said, Mr. Harrelson and Ms. Mack will be available at the end, and they have a slide, but throughout, I may be asking them for their input as well. So first today, I have the monthly COVID update for November. And we will go through these slides and again, ask any questions you may have. So as you look, the North Carolina weekly cases for October, and you can see the trend downward, which is what we were all hoping to see. Next, Craven County cases, and as you can see, the beginning of the month, 254, and on the 29th, we're down to 96. Again, a trend we're glad to see. The vaccination status, the couple of areas, red being Craven County, you can see there's a couple of areas Craven County actually is higher than the state. And we have a pretty good percentage as you're looking, comparing to the state, which is in blue, ages 12 to 17. We're pretty close to the state percentage there. All right. The positives for Craven County. Unfortunately, yesterday we did have 10. Sometimes the consequences of a long weekend, but overall, you can look at our cases, look at the student positives, there being the red, staff being the blue, and you can look at the end of the month, we had multiple days of 0 cases for staff and students. All right, positives. Some of the board members wanted to see how we're looking compared to last year this time, but I do need to remind you, as you look at this data, it appears certainly we're higher, but also remember our kids were at home during that time and they returned on October 19th and they were on a modified schedule. So consider that when you're looking at this data. All those reported cases just came with parents notifying us. All right. The quarantines, as you can see here, the blue is the staff, red being the students. They're also going down. I will remind you, at one point we had like 1,700 and we're down to 125 at the end of the month. Much better situation. All right, so this is also, next slide was showing a comparison of the quarantines. Again, remembering that it was not the need to quarantine students until after mid-month because they were already learning virtually. All right, level of transmission for the state. This is some really good news. I included this from last month so you can see a comparison. This first slide is the state of North Carolina in October 15th. The next slide is November 12th, and you see lots of orange and yellow. I was very excited, and I immediately reported to the board. 2 days last week, Craven County was one of the 10 counties in the state that was yellow. So that was really good news. Unfortunately, on Friday, we went back to orange, but our positivity rate remains very low, and I will discuss that with you in a few minutes. But you can see our state is all doing a much better job, lots of orange and some yellows. I will remind the board again of the two things that put us in yellow, remembering that you must have both. So you have to have cases per 100,000, must be less than 50 or 49.99 or lower, and less than 5%. Well, we're at, the positivity rate is 1.54. So we're in the blue, which is why I coded the positivity rate. So we're well below yellow. Unfortunately, the cases bumped us back up. We were down to 49, back up to 66. So that puts us back in orange. All right, just a reminder for the board and the public, our current safety protocols. And we did modify this last month. The board did approve to have visitors back in the building following the current safety protocols. Athletic events and band participation are in full force, as we saw. Unfortunately, our football teams last Friday night did not do as we were hoping, but we still are encouraging our students to participate in all events because we know our school experiences take place beyond the classroom walls as well. All day field trips are open for requesting approval. Overnight trips are also open for requesting approval with some safety protocols in place. And those go to Dr. Diggs and she reviews those because some of the overnight trips require months in advance because students have to start making payments and things of that nature. So we are accepting those, but of course we'll follow the board's direction as far as any other protocols. All activities and events are open with the safety protocols in place. All right, a little bit on testing. As you're aware, we approved testing. This first slide, we put this in there because we want folks to understand the testing that we will do is not like some of us have had if we've been tested that feels like it's a brain swab. These are not like that. They're little tiny Q-tips and just go inside the nose. But we're providing this only for those folks that would want it. It can be a service to our families. So this first slide is the one that I shared with you originally when we were talking about COVID testing in our schools. And we have already sought board approval on that for testing. So to talk a little bit about the benefits of testing, it again helps us focus on in-person learning. We're able to help those families know that if they're positive, they know that quickly. Many of our families, when this variant was at its peak, it was difficult to get an appointment. It could be 2 days out. Many families had to drive to other counties if they couldn't get one with the local doctor. So this would be a way to help those families and get tests back quickly with Mako Labs saying they can get the results back in 24 hours. Again, no cost. This is all through grant funding through the state. It also provides additional monies to hire additional nursing staff and to increase the hours of our nurses. And again, we've committed to supporting the community. If a family that has a positive student would like to be tested, we're providing that service to our families. Next, I want to make it clear that this is only done with the consent of families. No test will be performed unless the parents opt in. So again, it's not you have to opt out or we're going to do this testing. They have to actually opt into the testing. If a parent does not opt in, their child will never be tested. The parent can opt out in writing at any time. So let's say they did want to participate and later they change their mind. They can always let us know that they're no longer interested in participating. So the next little bit I want to talk to you about, there's two types of testing. The first is diagnostic. So that refers to someone with COVID-like symptoms or a known contact to someone with COVID. So this has already been approved by the board. The purpose of this to lessen the number of students and staff to remain out due to exposure to find out quickly if someone's positive. It could also reduce the number of days missed for symptomatic students and staff, particularly if they're negative. They would not stay out of school. All right, 2 more slides. Next one I want to talk to you about, diagnostic, one more. Screening, there you go. The screening testing refers to someone without symptoms, but maybe had a close contact and they're fearful that they may have been exposed. We did not, the board did not approve this for our students. We did not want to do random testing or anything of that nature. What we are asking today is that we do approve this for staff only. The reason being, and I'm not going to go into all of that because we all know, we've heard about if you have 100 employees and all that's in litigation. But if that is passed down and we're required to do some staff testing, we want to be ready to serve our staff so that we can get our staff in the building. I'm not going to say, I'm not going to stand before you and either say yay or nay to vaccinations. That's a personal choice, but I don't want our teachers or our staff to be out of the building if we can serve them if they choose not to get vaccinated. And I want to make this clear, if there's a mandate by the federal government, not locally, that we test staff, I want to be able to provide that service to our staff so they don't have to miss work for a once a week testing. So we would ask that the board allow us to do screening testing, which is not what you originally approved for staff. Again, only if the staff member requests that, and only if we're required by the federal government at some point or OSHA to do these tests. I want to stop there so there could be any questions. Mr. Duff.
On the screening test, and it's still, the last bullet says only students or staff who have opted in will be participating in screening testing. So screening testing isn't just someone having a decision to pull someone out of crowded testing.
Right, it's not a random test, it's when a staff member, we're only requesting that for staff.
The point I'm making is, what's the problem with just approving it, period? Why you're making a point as if we're not going to be doing this, we don't want anyone to think that. I mean, if you have to opt in to be screened, I mean, anybody, I feel like it could be the parents or the staff or the students. Why is it just the staff? If a student comes and says, I feel, I was somewhere and they were testing, I want to be tested myself. I don't feel bad, but I just want to be sure. What's the problem with that? I don't understand. What's the issue?
And that would be totally up to the board, but that would require two types of permission because some parents that we've had conversation with, and you want to come talk about that?
I mean,
Lynn?
but it would be the parents' decision.
It would, and some parents would agree to diagnostic, but they're not really interested in screening. So I will let
Well,
Luann
I
talk
guess,
to that.
please do. When my confusion is coming in, that will still be the parent's choice for that child to be screened, right?
Correct. So the current requirement is, in order for a student to be tested, whether it be diagnostic or a screening test, the parent must opt in electronically. The way it is set up through Mako Labs, and which is the state contracted vendor, is as an LEA, you can choose whether you want to do diagnostic, which is symptomatic, or screening. There was concern at the beginning that if we opted for both, that we would randomly screen students. And there was a lot of discussion around that. And when this was brought before you board members to vote, we voted at the time because we were in the peak of Delta and we had a lot of symptomatic students coming to school. And so we wanted to provide the service so we could get them tested on site and get the results immediately. The parent must opt in electronically. And then we, as school nurses that will be testing these students, would call the parents prior to testing their child, just as a courtesy call to say your child is having symptoms. We do know that you've opted in electronically. However, we are providing a courtesy call just to make sure you still would like your child tested. And because we know that the diagnostic testing was symptomatic only, that seemed to be what most LEAs leaned toward because of the peak of the Delta variant at that time.
But when you make that call to that parent still has the power to say, no, I don't want my child.
Absolutely.
So
Absolutely.
that takes me right back. I don't see the problem with going for both. You know, regardless what other LEAs have done. I mean, if the parent still maintains the power to choose what's happening with their child with this situation, it seems like it would be good to have it available to both sides.
And if you recall back when we reviewed this, we took a survey of our school nurses and the staff. And the school nurses wanted to do both screening and diagnostic. But the vote came down as we would do diagnostic only. So the recommendation from your school nurses is to provide screening and diagnostic, because we clearly know that mitigating this virus, that testing plays a huge role in identifying who has tested positive, who may be negative, who we send home, who we keep at school, so we can reduce the amount of time these students are away from receiving their education.
Anybody else has?
I just want to make sure, clarify for, I'm sorry, I apologize. For Mr. Dove, what Dr. Miller is saying and our nurse is saying is that when it came time to vote, this board voted for diagnostic, not screening. We voted, so it was our decision.
This bullet was more clear than it was last time, and I don't remember. But
You didn't see it
I probably
then.
didn't vote. I probably didn't vote with you all last time. I don't.
Maybe not.
Probably, yeah, right. But I understood everything she was
Gotcha.
saying.
Mhm.
But can we change?
We
I
can
mean,
change it.
The times have changed, and if you're still
Yeah,
recommending that,
absolutely.
can we change it? And it's no problem with the company to do that.
Absolutely. Okay, so the next slide is recommendations from school nursing. Offer screening testing for staff and diagnostic testing for students and staff who wish to take part of this free service with appropriate consent. But if the board so chooses, I mean, certainly we can offer both screening and diagnostic testing for students and staff.
Which is a recommendation of the nurses anyway.
Well, the recommendation is for staff,
For
certainly
staff.
for staff. We
Okay.
did, because of the board's previous vote and litigation that's currently underway, we may be forced, or staff may be forced to be tested beyond us, beyond the decision here. And we wanted to be ready to serve our staff if that ruling came down to us. So that's why the immediate concern was for staff, not so much for students.
But I thought that the nurses originally wanted both diagnostic and screening. That was my question.
They did. That is correct.
Yeah, question.
Ms. Kell, Ms. Meeks.
Y'all aren't gonna like this, but there's been lots of companies that have openly admitted on some of these COVID testing that they're like doing DNA stuff. Does Mako do that? And I think before we just decide to make a decision to screen kids, we need to send a survey out to families to see if families are even interested in this to be an option for them.
So the current testing by Mako Labs is we will offer a rapid or antigen test, which is currently what we do in our doctor's office, our provider offices, and the health department. That is a 15-minute test that our nurses will do. We will have the results in 15 minutes. That's currently what is being done when any of you have already been tested. The second test that's offered is the PCR, or the confirmatory test, which is the same exact test that have currently been done to determine if people should test positive. That's that send-off test. So the tests are exactly the same as what is being done at providers' offices, CVS, Walgreens, the health department. So the tests are not different than what we're currently being done.
I'm comfortable with doing it for staff for them to opt in, but I would like to have some parent feedback on this before we just say, okay, yeah, we'll screen kids.
And that's why I was asking the questions that I was asking. If this is made available for both, it's still in the hands of the parent to allow it to happen to the child, correct? So if there's a child that may be concerned about that situation, they probably would not then.
Correct. So the parent has a choice. They can opt for either one. They can opt for, or both. They can opt for diagnostic only, symptomatic. They can opt for
Or none of it.
screening, or
Or
they can
none of
opt for both, or none.
Well, none of it.
And in order, so the way this tees up is there's a dashboard, and the company Mako, it's called color.com. All our schools are already set up. Our nurses are already ready to go in that system. The dashboard also allows a parent portal. So when their child is tested and they've electronically opted in, they've also received that courtesy call that their child is symptomatic, and they still confirm that they want their child tested, they will be able to go in themselves as a parent and look at the results. They can look and see when that child was tested, it's time stamped, who the person was that tested that child, and the results, as well as that nurse. It's a secured system that only that nurse and only that parent can look at their child's results. So it's not a closed system that's closed out to the parents.
Ms. Apple?
Well, it seems to me that with screening, the parents opting in or out is the survey. That's the
That's what I
vote.
think too.
And so we don't have to worry about a survey because we can look at those results.
Mhm.
And it's in the hands of the parents. But I think it protects our students in one more level.
Mhm.
Someone else? Ms. Smith?
I completely lost it.
Uh-oh.
I completely lost what I was thinking. I'm not even gonna make it up. But it had something to do with the screening. It'll come back to me, guys. Sorry. It's
Okay.
having a moment.
Well, there was the question about DNA.
Mhm.
I don't have it.
So I don't know, Madam Chair, while Ms. Smith is
Oh,
thinking.
I know what it
Okay.
was. Okay. The nurses before, so now that the stuff has been transferred to the health department, they've been helping. So the workload, the nurses will be okay with the workload that might, because screening you'll have more for screening than you probably will with diagnostic.
Right. So where we currently are with that, we have partnered with Scott Harrelson and his nursing staff and the state contact tracers. We are waiting to get certified, our Craven County School nurses, to be on the software that the state is on called CCTO. And that's the Community Contact Tracing Operating System. And what that does is that allows a nurse as well as that state contact tracer to be able to look at the information real time. So for example, if we find that a student should test positive, in other words, the parent should call the school, let the nurse know. The nurse could enter into the CCTO system. At the same time, the state contact tracer has that information as well. And then we would list the close contacts because our nurses are the eyes inside the school. And they're the ones that working with the teacher and the administration can identify who is a close contact. Where we are in that process, we are waiting to get signed off and to be trained. And it's a matter of a training. And I have worked very closely with Jennifer Blackman, the nursing director at the health department. We have provided her the information that she needs to give to the state. So we are now waiting for the state to give us a date so we can be trained. So all of our school nurses can be trained in this. Right now, we are in the process. We have transitioned every school to the health department for contact tracing. However, we clearly all know that our parents have great relationships with their nurses, and they're going to reach out to that teacher and that nurse, and a lot of times let us know ahead of time that their student has tested positive, or they've been exposed to someone who's tested positive. So we still have a lot of responsibility within our school system that our nurses have taken charge with. And I'm gonna be honest with all of you all, they're having a hard time letting go because they have in 18 months done such a phenomenal job. And we're working very closely with Stephanie Chesney, who's the school nurse liaison with the Craven County Health Department. And she is our bridge to the health department to provide information to the state tracers. So Ms. Smith, the answer to your question, we're in transition. There still is some work on our nurses. However, we are seeing more transition into the health department than we've had since mid-October.
So you would be comfortable with adding that?
I will be comfortable once we become CCTO trained, because the software is really going to make such a big difference, because right now we have to send in a secured email the information to the school nurse liaison, who then forwards it to the contact tracer. So that has added a step to our nurses. But as soon as we are CCTO signed off and trained, I'm very confident that we can handle the testing responsibility for the Craven County schools.
I move that we accept the recommendations as articulated on the screen.
And this might, I think so, because previously you had only said diagnostic testing, so we would like the board to make a decision. And of course, your choices are, you've already approved diagnostic for both, so it's screening. You can either go students or staff only, and that is in the direction of the board will tell us what we need to do as far as preparing.
So what is your motion, Mrs. Clark?
That we accept the recommendations to include students and staff. That's my motion.
Screening for students and staff.
Yes.
I second that motion.
It has been moved and second that we accept the recommendation for screening for both student and staff.
With a really good acknowledgement to everyone that that's an opt-in.
Okay, now y'all need to put that. Now, what is the motion that I need to make the motion?
That
clear?
was it. That was it.
Okay.
That was in discussion part. I was just saying to really add the.
Okay, so we need to, okay, so the motion has been made and has been seconded. So now we need to, now we open it for discussion.
Yes, ma'am.
Okay, so any discussion on this motion? Miss Kelly? Ms.
I
Hughes?
think we're facilitating this federal mandate from OSHA and the federal government. I think we're facilitating it too soon. I mean, we don't even know what they're going to do yet. And there's court cases about this stuff popping up all over the place. And people feel so intruded on because we're doing everything we can to accommodate mandates and creating mandates. And people are so tired of mandates.
Well, I don't see it as a mandate if it's reading who wish. Am I reading that correctly?
It would be for folks that would opt in.
Okay, so I don't think that's a mandate if we say who wish to take part in this free service, because to me, it would be a benefit if, if I have symptoms or if I know of any close contact, to not have to seek out somewhere else to go and get my testing done, or if I could do it right there on the campus where I am, I see it as a benefit. And if it's voluntarily, done, I don't really see that as a mandate.
Mr. Doug?
She was, her hand was first.
I'm sorry,
I do
Ms.
wanna
Clark?
speak- I do want to speak.
I'm
after
sorry,
her.
I spoke out.
That's all right. Same
And then
reason,
Mr. Doug, yes.
same reason that articulated by Ms. King, mandate is just that. You have no choice. All of us on this board agree that parents have rights, but this is not the issue. The issue is asking folk to opt in. So that takes away any argument respectfully about there being a mandate. We are not trying to intrude and say folk must be vaccinated. That's just spreading misinformation.
Mr. Doug?
Well, it's kind of ditto to everything else. When the motion is made, if you could make it again and include the clarity that no one is trying to force anybody to do anything. A very simple analogy would be if you go to the cafeteria and you choose not to have pizza.
Yeah,
The parent
it's there.
can choose not to have their child included in this opportunity. But if the opportunity is in place, it's already there and set in motion if it's needed or someone does want it. Because I might want pizza, you might not, but I might want it. So I feel it should be available to those that want it. And if you don't want it, and I respect your opinion not to want it,
Mr. Akbar?
Thank you. I just want to be clear. My focus is not about OSHA or any directive coming from anywhere else. It's about the health and well-being of our students right here and what we can do in Craven County to help mitigate any spread and to keep our kids in the classrooms in front of their teachers and our teachers able to teach. It has nothing to do beyond this level in my mind.
And mine either, and mine either. For me, it's a convenience for staff and parents that want to do it to keep you from having to go somewhere else after work or after school or after that parent's work, pick them up and have to go get them tested. So it's a convenience. It doesn't have anything to do with mandates. It's an absolute option for them. They do not have to do it.
Any more comments? I think we're ready for the vote. We need a roll call vote.
And just to remind everyone of the motion, and correct me if I'm wrong, that this would be screening.
It's that recommendation for both screening for both staff and students.
Right. Okay, Ms. Frances Boomer,
Yes.
Ms. Naomi Clark,
Yes.
Mr. Victor Dove,
Yes.
Mr. Carl Alpert,
Yes.
Ms. Stephanie King,
Yes.
Ms. Kelly Muse,
No.
Ms. Kimberly Smith.
Yes.
Motion passes.
Okay, thank you.
All right, and next we'll talk about the update as far as mask. And just as a reminder for both the board and the public that we are required, or the board is required to look at the face covering policy each month, and you must adopt a policy, mandatory or optional, by employees and students for the 21-22 school year. The policy you adopt is only good for this year, and you shall vote at least once a month on whether the face covering policy should be modified. All right, the next shows as of the 29th, the School Board Association has not updated their mask map, but I do have some further information. This was as of October 29th, the red being optional, blue is mandatory, and the green is kind of a their own policy. It was not all or another. Sometimes it's age group or it's vaccination, not vaccination. So to update that, many local school boards approved changes to their policy last week. Now 20 school districts allow masks to be optional. Just for your information, Surrey County allows masks to be optional on a school by school basis. Hyde County allows masks to be optional for vaccinated students and staff. So this leaves 93 school districts that continue to wear masks, and 20 as of last week allow masks to be optional. So just to give you that update, which I'm sure will be reflected on the map soon, but it was not, so I wanted to give you that update. So here's where we are. Again, I've showed you this earlier. This is where we are. We're in blue as far as percentages of positive, meaning a low rate of the virus in the community. We are back in orange because we are above, we're at 66, which would put us in that 50 to 99.9 category. All right, so based on the previous month, the board had agreed when we had been in yellow for 7 days that I would contact the school board chair, have a special called meeting that would be noticed to the public for the purpose of making masks optional. It's important to note that regardless, until there's changes above us, that masks will still be required on all public transportation, which is federal law. So all of our buses, regardless of the local policy, they would still be required to wear masks until that is updated at the federal level. And then my next item, so we don't need action on this now, will be to talk about the actual policies and for the board to take a look at them. All right, so next, exemption request. Currently, we've had 67 submitted, 39 approved. As we PDSA'd the process was in place before many of the folks took over and now manage the process. So we looked at the process. One of the things that did not occur previously was parents being included on the committee. I have met with the chair of the mask exemption committee. Parents will now, if they so choose, will be invited to participate on the committee and give their input regarding their child. Again, I want to make it clear that if any exemptions are denied, there is an appeal right. A parent can appeal that to me. That has occurred. And we have, I have requested that the committee go back and review it. And in several situations, the committee, due to now changes and the positivity rates in schools, they have previously an exemption that was denied has been approved. So I just want to make it clear that if a parent is denied, they can always appeal that to me.
Ms. Muse?
I'm a parent that went through the mask exemption process. We all talk about children's social and emotional well-being. I was informed after I had a licensed therapist come to my home on a Sunday that a therapist's recommendation for a mask exemption would not be acceptable because they cannot write a prescription. never mind the mental health, but because they cannot write a prescription. I think that's terrible. I also received a letter from a parent who had to appeal their mask exemption. And some of the verbiage in the second paragraph, this parent was told, although we feel strongly that it would be in the best interest of both child A and child B to wear a mask in school due to their environment, health concerns, and their proven ability to successfully wear the mask, we acknowledge the licensed medical provider has signed the form supporting a mask exemption for both child A and child B. The committee therefore will allow you as the parent, to follow the guidance of the provider, and the mask exemption will be granted. I didn't know that we were in the business of determining what will allow parents to do based on medical recommendations. That's terrible. And as a mom of a child who has a birthmark in the middle of her face that she receives laser surgery on, and how dare anyone tell me what you will allow me to do based upon a medical provider's recommendation? That's offensive. That's really offensive. And my heart hurt for this parent, and that's not our lane to determine what we will allow based on a medical provider's recommendation. And we all talk about the social emotional well-being of our children. And when you have a licensed therapist recommending something and the school system says, oh, because they can't write a prescription, that's not going to cut it. I
And,
have a problem with that.
and Mr. Swain is in the room, and if he would like to talk to this, but I think the issue is it has to be a medical, a doctor, not a counselor, to set the guidelines. It's someone that could write medical orders, which is what our nurses follow.
But a medical provider doesn't always determine if a kid is suicidal based on their social emotional well-being. A counselor and a therapist does that, not necessarily a pediatrician. And a pediatrician may not even know, or a dermatologist may not even know, or a neurologist may not even know. But that's what a licensed therapist does. So how can you discount them?
And all I can say is what the form says, and it says medical doctor, which one of the examples is able to write a prescription, and counselors typically work under a licensed, like psychologist or psychiatrist.
Ms. Clark?
Just point of order, Madam Chair. I don't know the verbiage to request that we go into closed session with our counsel, but there's a issue that I think needs to be addressed.
Ditto.
Okay. And I would ask that we do it now.
Me too.
Mr. Gatto, what is your advice?
Yes, sir.
That motion would be to go into closed session in accordance with North Carolina General Statute 143.318.11A3 to consult with your attorney, preserve the attorney-client privilege.
That would be my motion, ma'am. Second.
It has been moved and seconded that motion that he just said be approved. Are you ready for a question?
Yes.
All in favor, let me know by saying aye.
Aye.
Those opposed, the same. So we're going to, for the rest of you all can take a recess break, and we're gonna go to the closed session.
Okay, we're going to close session. We'll fire the meeting back up once they are out.
Mr. Harrelson.